I found out that I had cancer for the second time in March of '08. Found out because I'd had a biopsy from a surgeon that I was referred to. I had actually discovered a lump in my breast, and I had a feeling that it was not going to be good news. Sort of at the last minute, my husband asked the surgeon to also biopsy my skin, and in fact it was the skin that was the problem, because that's what evidenced the inflammatory breast cancer that I was diagnosed with. So the day we found out, you're filled with horror and terror. We dealt with it as a family, and with a great deal of prayer and research. And by the end of the day, I felt that I knew I had enough facts to go forward, but we were most anxious to meet with the oncologist. When you're that fearful and that anxious, the oncologist has a huge role to tell you what your options are, what the diagnosis is, where she's going to go from there. Waited a week and a half before we met with Dr. Reyes, and that was one of the most hopeful days of our lives. She said that she could take care of it. If I gave her a year, she would give me my life. Dr. Reyes recommended several rounds of chemotherapy. I had so many fears and anxiety going into chemotherapy. Primarily, I was concerned about the nausea. I have to say that I had perhaps a total of 2 days of nausea the entire time. They give you so much to help you with that it was just a non-issue. The chemotherapy itself is completely painless. It was as positive an experience as you could possibly have dealing with what you're dealing with. The side effects that I experienced were I had a lot of mouth sores. My throat was very sore and tender. There were days where I had difficulty eating because my mouth was so sore. I did have some muscle pain and aches, and I would call them bed days, days that I just didn't feel like getting out of bed. However, they give medication for just about every symptom that you could possibly imagine. And they give you a thorough list, it's about 2 pages long, of side effects that you could possibly have. And so you read through those and identify the ones that you're experiencing. And if they're serious, you call. And if they're not, you just put up with it. I must say that my sister had the flu while I was going through chemotherapy, and she suffered more with the flu than I did with chemotherapy. I cannot think of any lifestyle changes I've made other than for that year you are dealing with medical things every day, and so you don't for that year have what you would consider a normal life, because your life is made up of things like your temperature, your white cell count, what day of chemo you're on, am I going to be tired? So that year I was not able to be out in public, so I had to forego things like shopping trips with my daughters and going to church and even going to the movies. We just put all of that aside for the months of therapy so that I would not get any kind of an infection. I believe that the Lord provided compassionate cancer care for my family and I, because from the day that we walked in, we felt that we were being cared for in an extraordinary way. From the office staff to the nurses, to the doctors, everyone seemed to truly care and understand what we were going through. Dr. Reyes is my oncologist, and she is an extraordinary human being in that when she walks in the door of the office, there's no one else in the world except the patient and my family. And she was so personable and so thorough. She answered every question, but she didn't answer it to the degree that you felt that she was losing you. She wasn't so highly technical that you didn't understand what she was saying. Not that she couldn't be technical if you wanted her to be. And when I would do my own little research online and that sort of thing and come in with questions, she knew exactly what I was talking about and would answer them thoroughly. She didn't bypass the fact that we were gravely ill, but she did not for a moment indicate that we were without hope. Currently, now that I'm done with my treatment, I only have to go once every 3 months for tests. I'm still running a lot of tests to make sure that the cancer doesn't come back. You tend to miss them because they become like family. And so to go 3 months without seeing all those lovely people is a little bit of a hardship, but they've moved on, obviously, to other patients, as they should. And the highest point is the first time you have the scan after treatment and it comes back clear. And you jump out of the office saying, I don't have cancer anymore. And so in between every one of those tests, because you know you have a test about every 3 months, so in between every one of those tests, I believe I'm cancer-free and I live like I'm cancer-free.